And we are recording. So welcome to week 2, Marketing Perspectives. This week is a recap. If you have already done fundamentals of marketing in semester 1, the material that this week relates to sort of rehearses some of the things you will have done in semester 1. That doesn't mean that you don't need to bother with this week if you've already done marketing fundamentals. It will be at least a useful revision for you, but also as you might have found by looking at the coursework materials and going through the videos in preparation for this week, one of the things that you're required to do in your coursework is you're required to target a specific segment, and segmentation is a big part of the marketing task, and it continually presents you with challenges and the requirement for sensitivity to the characteristics and behaviors of the different segments that you're serving throughout the marketing process, all the way from product development right through to communications, after sales care. So although it might feel like we're going back to fundamentals, these fundamentals are called fundamentals for a reason. They are underpinning all the other more specific discussions that we're having throughout this course in the different marketing perspectives that we take. So I'm going to just move on to the slides that I've shared with you already. So if you've had the chance to look at these, that's fine, but there's no need to particularly have these in front of you. I'll just be going through them. So that's just a reminder of what the class does. I think it's useful to always remind ourselves of what the class overall is trying to achieve. As you know, we're looking at fundamentals this week, and this is the first time that I'll be doing what I will normally do week by week, which is looking at the instant feedback that was left by you as a class for me in the form on the class website. And I'll tend to focus on the things that require me to do something. So there were a lot of you that left instant feedback who said basically very positive things about last week and didn't have anything specifically to cover. So I appreciate that a lot. Thank you. It's good to get positive feedback that you're liking the format of the class and things so far. But there was one item from someone this week that I thought would be useful to bring to class. So you can see on the screen, this request was for a deeper insight on consumer psychology throughout the course, as all of marketing, however effective, is only relative on how the consumer interacts and perceives it. So deeper understanding on the psychological standpoint would be helpful. That's a really helpful comment for me, so thank you. And I will do my best to bring consumer psychology into the materials throughout the weeks. That is covered naturally in some of the videos in the lecture prep already, and I will endeavour to try and bring a flavour of that week by week in our discussions. But I certainly tried to bring in a specific element of consumer psychology for today's session. So looking at fundamentals of marketing as a whole, hopefully you've had the chance to go through the lecture prep videos that are online. I'm just going to jog through some of the broad things that were covered there. Not going to spend much time at all on doing this, but you will have seen marketing definitions, so pretty helpful for us to start today, just refreshing on that. Marketing is the activity, set of institutions and processes for creating, communicating, delivering and exchanging offerings that have value for customers, clients, partners and society at large, satisfying customer requirements profitably. It's a reminder that marketing in its conception as a subject area is one that's born out of capitalism and markets. So the idea of doing something profitably is embedded within our understanding of marketing. But as we'll see in this class, marketing does go beyond simply basic maximization of profit. The thing that, if you've done marketing even at school, you probably even covered the 4 Ps of marketing at school, but necessary to keep them in your mind all the time. And it is amazing how easy it is to forget about the 4Ps, and they provide a good kind of solid reference point, regardless of what you're doing in marketing. So product, price, place, and promotion. In terms of marketing, we're thinking about what the product is. So marketing, as you'll have heard me cover in the videos, marketing covers everything all the way back from new product development, so the very origins of any kind of product, any kind of service. Marketing has a place in that. So why are you creating it in the first place? Who for? Pricing is essential. It seems so obvious that you can kind of ignore it, but this is the best way to look at it. Price is the only thing that actually commands what income you generate from your customers. So if you've not considered how you price something, both what the number is on the label and the strategy around how you arrive at that number, how you might offer discounts, how you change the price in response to perishability or competition or seasonality. Price is so important, and it's constantly important day by day, so it needs to be dynamically monitored. Place, as in where you put your product, how you put it in front of the people that you want to buy what you're selling, and also how you actually communicate and animate the thing that you're offering the market in order to make them want to get it, want to buy it. So how you promote it. Those are the 4Ps. We have to be in tune with consumer behavior. So all the different dynamics around about how those people that we're trying to get their money for our thing, what are the dynamics around how they will relate to what we're offering, how they will listen to what we're saying, how we'll identify who we want to talk to, and so on. So you see the five principal questions there. Where do these people buy? What are their choice criteria? So how do they come to the decisions that they make? When do they buy? How do they buy? And who of them is most important? So that's partly a segmentation question, which we'll come on to. The sticky toffee pudding model, as I call it, the STP model, which is if you sit around a table for an organization having a meeting around about a new product, this is essentially what they're talking about, is segmentation, targeting, and positioning. So first of all, they have to segment their market. They have to understand what their market is, and then how they subdivide that into manageable groups that have distinctive characteristics that they will match their offering against. Thinking about which of these different subgroups, these different segments, represents the best opportunity. You quite often hear businesses talk about beachhead markets, which is using a kind of sailing term, but if you find a beachhead, it's an easy place to get to land. So a beachhead market is the place that you would go to which is going to provide you with enough revenue to get yourself to your next strategic step. And segmentation is the process that would be done before that. So you then have to think about which is the most attractive of those segments, and how are we going to get them to part with their cash. And then positioning your product, understanding where your product sits in relation to other products which are available, and the messaging that you attach to that to communicate with your target audience around about what your product is. So is it a prestige product? Is it a value product? Is it a daily purchase? Is it a one-off purchase? All these kinds of things, and all of the positioning criteria go towards communicating with your audience what your product is. Since we'll be focusing on segments today, just a little bit more on the segments stuff that you would have found online. So it's simply put, we can divide our market into different subgroups, subcategories. Sort of using the example of cameras here. So you've got different people within your market who would want portability and compactness. You'd want people who would be basically price sensitive, but not sensitive around about portability. And then you'll have people that might be sensitive towards picture quality and a range of functions. And those are product-driven ways of segmenting your market into different subcategories. You'll then have people that will want a particularly high level of functionality and quality. So you've got kind of market niches, as they're called, sub-segments within an already identified segment. And then you even have micro markets, which would be people who are interested in functionality that is very specific and very particular, and has specific distinct requirements according to that. And that's why the provision in market niches and micro markets tends to result in higher prices, because higher price can be commanded on the basis that you're providing for something that's rather particular. Therefore, you have fewer competitors usually. There's an acronym for remembering market communications. So we want to differentiate, reinforce, inform, and persuade. That's what we're trying to do when we communicate with our market, and you can use the DRIP acronym to remember that. And we also touched on branding as well. Branding is a natural part of marketing because it's something that you have creative control over, that you can use to embellish and strengthen and add value to your offering. And as we know, brands also encapsulate means of communication and positioning in and of themselves. So they are an important feature of the marketing mix. And you got the example of Mercedes-Benz and the different levels of brand meaning that we associate. So we've got basic attributes and the benefits we get by being a patron of that brand, if you like, the values that being a patron of the brand represent to you, and idea of personality. So what reflects on us on the basis of being associated with that brand. Just put this slide in again to remind us that this is the general pattern that I will be following week by week. So we'll cover the sort of feedback from last week and what's happened since we last met. I'll then give, hopefully as brief as possible, a refresher on what you've been covering online. And then we move on to a discussion element. So items that I think are sort of interesting, let's say, that are also relevant to the topic of the week, and we'll move on to having a light bit of discussion in relation to that. So we've done feedback, we've done a brief refresher on what you should have covered in your lecture preparation materials. And now we're going to really focus on segmentation, like I said. So I thought it would be fun to look at segmentation through something that we're all familiar with at the moment, which is the coronavirus pandemic. We can't help but be familiar with it, unfortunately. And on the positive side, we are at the stage of having working vaccines that are now in the process of being rolled out around the world, and different countries traveling at different rates. So I know that you're not all in the UK, so some of you might be in a country that is a bit further behind. But I'm using the lecture this week to focus on the UK, since we're based in the UK and as the Edinburgh campus. So we're looking at segmentation through the lens of coronavirus. And I'm going to show you a video which just gives us a little rundown of the situation on how the vaccine is being rolled out in America, just as and it maps pretty closely onto how things will be done in the UK, but I've basically chosen it because it's a good video, to be quite honest. So I'm just going to try and share that with you and also share my sound. If you just give me a little second.
Okay, I don't know at what point this is live. I think it's live.
A vaccine for
COVID-19 could soon be available in the US. Over the next few months, there might even be several that get authorized for public use. COVID-19 vaccines are expected to be an important tool to help end the pandemic. If a large portion of the population gets vaccinated, the coronavirus will not be able to spread to new people and will then die down. Pandemic over. So, how does our society figure out who gets them first? Here in the US, federal and state governments are coordinating on vaccine distribution, and they're considering the ethics and logistics that will go into giving out COVID-19 vaccines. The main guidance will come from a federal independent advisory group to the Centers for Disease Control and Prevention called the Advisory Committee on Immunization Practices. This group will make recommendations for each authorized vaccine on dosage, on schedule, on priority groups, as they have for over 50 years. Their stated goal is to use COVID-19 vaccines to reduce severe illness and death from the disease and to minimize disruptions to society and the economy, which basically means keeping our food, healthcare, and transport systems up and running. That might sound pretty clear, but there are a lot of considerations within that goal. For instance, if preventing deaths is most important, it might make sense to vaccinate older people, especially those in nursing homes, first. Their bodies are less likely to fight off the virus successfully. 40% of coronavirus deaths in the US come from long-term care facilities, such as nursing homes and assisted living. And preventing those deaths also means vaccinating healthcare workers in these facilities and elsewhere. There's consensus that these two groups should get the vaccine the soonest. Healthcare workers include all people who make it possible to care for COVID patients and could get exposed in the process, from doctors and nurses to cleaning staff, cafeteria workers, and nursing home aides. Giving healthcare workers and nursing home residents first dibs on vaccines is meant to protect those who have more exposure to the virus because of their jobs, and also those who are more likely to die from the disease. The CDC says healthcare workers are also big influencers on people's health decisions, so the example they set could help convince others down the line to get vaccines. Other high-risk groups like people with kidney and heart disease, or bus drivers and grocery store workers, or people 65 and older will likely come next. The order in which they will be offered depend on the traits of each product, such as whether they've been tested and proven to work in certain populations. Other big factors include availability and distribution. Another big vulnerable group the CDC is looking to prioritize is low-income and minority communities. They've been more likely to catch the coronavirus and to get very sick or die from it during the pandemic. Health researchers say it's because they're highly represented among essential workers and often live in crowded households. They spend hours in contact with strangers because they can't do their jobs from home. They also face discrimination and poor access to health care. Vaccine makers have also taken steps to ensure low-income and minorities will be protected from COVID. They've been recruiting people of different races, ethnicities, and health conditions, so they'll have the data to show whether it's safe and effective in diverse populations. But setting vaccines aside for people is one thing, and getting them into their arms is another. That's a separate set of blueprints that health departments are working out.
Okay, so just jumping on to another little piece of information before we move on to our discussion. That was obviously to do with the US, but I think it's a really nice overview of some of the questions that are needing to be considered by those that are making decisions about vaccine rollout. And I'm just sharing with you the BBC's page for the UK, because I'm going to anchor our discussion around about the UK, as I said. So these are the 9 groups that will get the vaccine first in the United Kingdom. This infographic kind of demonstrating the queue. So we've got the front of the queue here at the top with care home residents and care home workers at the front of the queue, group 1. Then people aged 80 plus and frontline health and social care workers, group 2. Ages 75 to 79, just broadly determined by age. Then 70 to 74 who are clinically extremely vulnerable. Then anyone aged 65 to 69, then anyone aged 16 to 64 with what would be called a qualifying underlying health condition, so something that your doctors are already aware of that would compromise your ability to fight off the disease if you got it. Then everyone aged 60 to 64, everyone aged 50 to 59, then everyone aged 50 to 54, and so on. That's as far as they've got, and they're the primary target groups that were being talked about at the moment. We'll just jump back to today's presentation. What this decision around about groupings represents is a form of segmentation. The public health decision makers in all countries are basically having to go through a segmentation process and decide on which segment gets targeted first. So it's actually quite a useful example of segmentation for us to discuss. And obviously it means a lot to all of us now. So you will have a degree of buy-in to thinking about vaccine rollout that we might not necessarily have the same buy-in for if we were just giving a random product example. So what are we talking about with market segments? Because these are not groupings that are naturally occurring. They're not objectively identifiable. Someone is deciding that this group is going to be targeted, that this is a group and then they're going to be targeted. So they're not naturally occurring entities. Someone's made a decision around about them. And in a marketing sense, that means that marketing managers will have created them based on how they view the market to help them basically develop their strategies and better meet consumer needs at the highest expected level of profit to the firm. But you translate that for healthcare, that's just the same as trying to maximize the ability to fight off the virus to reduce deaths. It kind of translates across. In marketing terms, segmentation strategies will help managers look for new product opportunities or improve their targeting and advertising, promotional messaging, and overall achieve better matches between what it is they're selling and who they're trying to sell it to. So that's kind of overview from the marketing perspective, crossing over into what we're looking at with coronavirus. Now that I've showed, I assume that most of you will be relatively aware of what the plans are around about rollout, and you'll already see that in the video that I showed from America, they talk specifically about minority ethnic groups, which is not something that has been included in the United Kingdom's grouping strategy at the moment. And that's a point of discussion that we're probably going to go on to touch on. But I'm just interested, going to do a little poll again here. It's very simple. So we're going to take your temperature on this at the moment, and then we're going to go into a little bit of discussion, and we're going to see if the opinions are the same by the time we've ended our discussion in about 10 or 15 minutes time. So for now, if you could answer, do you think the UK government have got their vaccine segmentation right? That's great. So about half of you have responded so far. Thanks very much. If you could, that's great. 2/3 of you have responded now. Keep going. About 20 odd left of you to respond. Okay, so 15 odd left you to respond. If you could just if you could give me your response as quickly as you can, I'd be grateful. 10 more seconds. Okay, we're going to stop there. So this is, a few of you haven't managed to respond, but so 83 of you are saying that you think that the UK government has got the strategy correct. 39 of you don't think so, which is very interesting to see. I'm just taking a little note of that because it'd be interesting to see if things have changed at all after some of the discussions that we have. So yes, 83 think that they've got it right, 39 think no, and 13 no responses. Thank you very much for that. I should say at this point, as we're about to go on to kind of discuss it in more detail, I'm never going to be deliberately adopting a side on a discussion like this. I'm merely interested in trying to provoke points of view and to perhaps, offer the alternative standpoint on the one that might be the common one or one that's up for discussion at that moment. I'm never interested in trying to embarrass or engage in conflict with anybody. This is not the point of these class discussions, but it's just about seeing the diversity of viewpoints and understanding what informs our different viewpoints, and that helps us understand things more deeply. Even if you don't agree with someone, you're allowed not to agree with someone. But part of the beauty of higher education is that we are able to engage in these conversations openly and respect the fact that people will have different views. So it's great to see that there's not unanimity in the positions that you hold at the moment. That's great. So people have opinions. I'm going to go into breakout rooms in a little second, just to give you the chance to consider some of the questions on the screen at the moment. But the questions that public health officials are asking, they've all got to engage with this fundamental question of who gets vaccinated. So who gets prioritized in the process of rolling out a vaccine, and that is complicated when we don't actually know who it will work best for, because we're in a situation where the vaccine is so new and has only gone, of course it's gone through tests in terms of establishing that it is safe, but it will take years and years of using a vaccine before we understand the subtleties of who it works best for, under what circumstances, and all kinds of different variables that are in play when we're attending to a whole population. We don't know in which environments it will work best in. And then we've got our understanding of who is most at risk from the virus. So we've got age is evidently the significant feature in this one. So that would be what we would call a demographic segmentation feature. So we're understanding and grouping on the basis of its demographic characteristics, whether that's age, gender, ethnicity, and so on. And we know that I think over 99% of all the people who have died of coronavirus have been over the age of 70. So we know that age is a really significant factor. We've also got other features like where people are. Are they in care homes or are they in the community? Other health risk factors. So that's mentioned in the British one as well as the American one. So other known health issues. Your occupation. So are you a healthcare worker or a care worker? So how are we drawing these boundaries? There's also questions of logistics. So this again is a question that you'd have in marketing, which is, well, how do we actually get to these people? So it might be a priority to get people in care homes, but as we've seen in Scotland, for example, Scotland is prioritizing more than any other group care home residents, but it's using the Pfizer-BioNTech vaccine because that's the one that's currently being distributed, and that has to be stored at very low temperatures. Therefore, in order to move a vaccine to locations that are spread out, because you have to actually go into the care homes by necessity because the residents aren't mobile or easily moved. So you have to transport a vaccine that is stored at very low temperatures to different remote locations in order to administer the vaccine. That slows the rate at which you can administer the vaccine down. Therefore, you see that Scotland is far behind in terms of administering vaccine, but it's far ahead in terms of how many of care home residents have been vaccinated. And the statistics on your risk to dying as a care home resident are very high. So these are things to consider. I'm going to put you into breakout rooms for about 5 minutes. I'm going to be about breakout rooms of about 7 people, and I'd like you to consider these questions. How would you define your groups? How should they be prioritized? And what different things do you think are really important in understanding who should be getting the vaccine first? So I'm going to. Let me see. Cool, okay. Just going to start on breakout groups. We're just going to have 5 minutes. So for the next 5 minutes, if you could discuss, you can discuss on whatever way suits you. So you might want to share with each other how you answered the poll question. Who did you think? Do you think the UK has got it right? If you said yes or no, and why you think that, you can Okay, everybody, we're back in the main room. I joined a couple of breakout rooms there, and thanks for the contributions that I got from the folks that I chatted to. Very interesting, some of the different points of view coming across. I will note I would very grateful for your feedback here in the main chat bar, just as we're in the early weeks of this class. I mentioned breakout rooms, and there was a mass exodus of students from the session. I think we had about 135 people here before breakout rooms, and there's 100 people left. So I know that only those who remain can tell me why, but is there a general feeling that breakout rooms are unhelpful, or you prefer to do something differently? If you could jot it down in the chat, I'd be grateful, because I will change my approach if there's a strong view. So I heard some good, some nice points from. Okay, thanks for the feedback there about breakout rooms. And some people have written on screen, even people don't like to contribute to discussions. Polls. Okay, these are good. I'll maybe use whiteboards as well. I appreciate the feedback from you all. Just continuing with the stuff on the vaccine rollout and things. The different points of view I heard in the groups were actually focusing quite a lot on student populations, and that's understandable because you are students, so you've got a consideration for what's going on around you, and also working population. So a balance between understanding the risks people are exposed to and economic recovery. The economy has been devastated by the pandemic, so there is a need to get the economy back up and running. There was this question that, well, students are known to be big spreaders of the virus, so therefore you should vaccinate them as quickly as you can, and that will reduce transmission. Although, of course, there is the question whether transmission is actually stopped after you've been vaccinated. Some statistics for you. So people of working age, and this is all from the UK. This is from government statistics. People of working age in the most deprived areas of the UK are almost twice as likely to die than those in the least deprived. For Black and minority ethnic groups, men are almost 3 times more likely to catch COVID-19, and among those who catch COVID-19, those of Bangladeshi ethnicity are twice as likely to die. And other minority ethnic groups are between 10 and 50% more likely to die. So when accounting for age, Black men are almost 4.2 times more likely to die from COVID-19. One of the things they note among Bangladeshi communities is that Bangladeshi communities in the UK have the highest percentage of household overcrowding in the UK. 30% of Bangladeshi households are overcrowded. Only 2% of white British households are overcrowded by comparison. And then Bangladeshi, Pakistani, and Black ethnicities were most likely to live in the most deprived areas. The Black community represent one of the lowest vaccine acceptance rates as well. So one of the compounding features is that men in particular from the Black community are over 4 times more likely to die from the disease, but there's a very low acceptance rate of the vaccine among that community because of systemic abuse and discrimination that has been meted out against that community in the past. So one of the things that's happening is that a legacy of discrimination is now causing difficulties with acceptance of the vaccine. So medical trials in the past were done on the Black community, which involved preventing them from getting access to treatment in order to study the progress of the disease. That was specifically for syphilis in the early 20th century. So there's a legacy of lack of acceptance among certain groups, and those are the groups that are also particularly vulnerable. So there are some compounding impacts. You look at the numbers, for example, on the impacts of minority ethnic groups. You're over four times more likely to die if you're a black man in the UK than if you're a white man. So they are considerably higher risk. That's accounting for age differences as well. So there are already known subtleties to the way in which the viruses manifest and the impact of the disease affects different people. And some of these things are relate to segmentation in that it's to do with behaviors and the way in which we engage with things and the way in which the things that we take priority from. So you could look at this through the prism of trying to protect others, because at the end of the day, you'll have heard of the phrase herd immunity, but the only way to tackle a viral pandemic is herd immunity. How you achieve that herd immunity is the question. Do you let everybody get the disease and lots of those most exposed to it die, which is obviously what we're trying to stop from happening by all the lockdown measures, or do you achieve herd immunity through vaccination? Obviously, that's the effort that's being made now. But it's a little reference to segmenting based on the behavioral perspective. One of the reasons that the groups are being established the way that they're being established for the vaccine in coronavirus is because it's easy, it's simple, it's straightforward, it's binary, so you can very easily determine whether you're in or out of the group, and it's in lots of ways inarguable. And you might say that is why ethnicity hasn't been approached, because there may be communities who identify as one ethnicity or the other, or people who consider themselves to belong or not belong for various reasons to different communities, and as a result, the lines become more blurred. So behavioral perspective is more complicated, and in marketing, the behavioral perspective is more complicated. So often things default back to demographic or very measurable psychographic features, because they are measurable, because we can count. We can say there are this many people in that group and that many people in that group, and we can very easily compare them. But there's an argument that the behavioral perspective in marketing is more effective, and the way that we do that in determining how we engage with something in terms of use in a segmentation process. If you're not going down the psychographic or demographic route, you're going through the behavioral perspective, you would look at utilitarian or informational benefit. So how do different groups understand the utilitarian benefit of a product? So that would be its use or its instrumental or material benefit. Like if you're buying a kitchen cleaner, then how well does it clean? Informational benefit often relates to brand. So that would be differentiation from other products and intrinsic characteristics that you associate with it, and that allows you to kind of make a judgment as how you value something. So different segments that you establish will have different levels of sensitivity to changes in the ways in which things are communicated to them based on the functional benefit of a product or its brand, what its brand tells you about it. So you can see those behavioral things, you can see how they're a little bit more complex, and we see that in, for example, the levels of vaccine acceptance among the Black community in the United Kingdom, which has a long legacy, which has shaped a behaviour and an attitude which is perfectly understandable and is the fault of systemic discrimination in medical trials and medical research. But that's an example of an issue that you have in saying, well, we're establishing certain groups, and when you have, for example, statistics that say Black people are 4 times more likely to die, and Black people are unlikely or less likely to be accepting of the vaccine, and Black people aren't also getting any special provision, or Black and minority ethnic groups to make a wider category. They're not getting any special provision in the way that the vaccine is being rolled out, or communication around about the vaccine. That makes you think, are they have they quite got their groupings right here? Are they operating in reality? When we think of the behavioural perspective, maybe certain groups should be prioritised because they are unlikely to engage with the benefit of a vaccine. So going to just run that poll again. After any discussions that you might have had in the breakout groups and based on what was contributed just there, I'll ask the question again. I just wonder what how your discussions might have changed the way that you're viewing these things. For example, you students are also the drivers of the economy as you graduate and go out into the working world. So 30 of you still not responded, so if you don't mind giving a response, that'd be great. 15-ish of you left to respond. If you could respond, please. Last couple of seconds, if you could respond to the poll on screen, that would be great. Okay, we're going to stop there. So there are the results. 47 of you think that they've got it right. 37 no, and a few of you didn't manage to respond. Obviously, because a few people have left, there are fewer of you in the poll. But certainly, last time 83 people said yes and 39 said no. This time 47 people said yes and 37 said no. So it would seem it's difficult to tell because of who's left. It seems certainly a lot of people who perhaps supported the UK's decision have also left the session. But you can see there's a lot more balance in the views of the group than there was previously, which is interesting. So finish that there. Okay, just a couple of minutes left of the session to go. So that we've covered a review of the fundamentals of marketing and particular focus on segmentation. You will have hopefully seen that the coursework brief is now available online on the Vision site, and therefore if you've had a chance to look at it, you will have seen that segmentation is a feature of the consultancy project. So this was a bit of recap and getting your juices flowing on segmentation and thinking about it. Hopefully it's been helpful. I'd normally look at the materials for next week just for a minute or so, but the good news is that all you have to do in preparation for next week is look at the coursework briefing online. So jump onto Vision, make sure you've downloaded the brief, have a good read through it, and you can look at the segmentation stuff as well. And I'm going to spend the whole session next week going into detail on the coursework requirements. So William, you've asked about tutorial. I sent an email last week just giving you details on the tutorial sign up. So just to remind you that tutorial sign up is going to open immediately after this session. So as soon as I'm done here, I will be going straight to Vision and clicking the groups to open. So if you're keen on bagging yourself a place in a particular slot, then just stay on Vision for the next few minutes. And as soon as we're done here, I'll be opening those groups up for the sign up, and it's found under tutorials for the Edinburgh section on Vision. So that's us for today, folks. Thank you very much for your participation. Patrick, there's a lecture scheduled for week 6 on the timetable. Is that correct? No, it's not correct. And where on the timetable are you seeing that? Thank you, everybody who's saying thank you. Appreciate it. Which timetable are you seeing? There's a class in week 6, Patrick.
So, I just checked the timetable a few days ago, and there was a class, just this one from marketing perspective on Monday.
But where did you check?
Oh, like the timetable website.
The university timetable?
Yes.
Okay, well, I'm sorry, it's a mistake, but there are no classes in week 6, definitely.
Okay, just wanted to check. Thank you.
Yeah, no problem. Thanks for letting me know. Okay, everybody. So that's the end of today's session. I will stay around for a couple of minutes if anyone has any other questions, and obviously you can get in touch with me directly on email if you've got questions that you want to ask specifically. But thank you for your attention and your participation, and for your feedback, of course, as well. So take care. I'm going to stop the recording now.